Okay, well, it's 6 o'clock. We have quite a few registrants that will be joining us tonight. So I just wanted to get started and talk about hormones. So thanks very much for joining us this evening. We're going to talk about some of the biggest issues that a lot of people face, mainly women tonight. I won't talk so much about male hormones, but primarily women. And we're going to talk a little bit about kind of the nuances that go along with hormones. And what I mean by that is sometimes you may run into situations where it's difficult to speak to certain providers or to certain medical professionals about hormones, especially about testing. And then we're going to talk quite a bit about why all of this is really, really important. And it comes down to what is best for you and safe for you. So honestly, hormone imbalances can start even in the 20s, sometimes even earlier, but definitely beyond. And there's a wide variety of reasons behind hormone imbalance. There isn't just one. And even family members can have a variety of, very distinct patterns of hormone imbalance that aren't necessarily rooted in exactly the same manner. Genetics does play a role, that there's absolutely no question there, but more importantly, it's environmental issues. It is diet, it's exercise, it's weight, it's so many other things. And we're going to talk about the whys about that. And I also want to spend some time specifically talking about the individual major hormones, a little bit about the estrogens. There's 3 of them, progesterone, and a little bit about testosterone. But then we're going to talk about therapies and testing and all of that as well. If you have questions at any time, please drop those into the chat box and we will answer those as we go. Scarlett is our moderator tonight and she'll be able to help us with those. So just jump in and ask questions, not a problem at all. So premenopause, those years, sometimes 20 to 25 years prior to actually stopping menses, which is called menopause, can happen very early in age. Hormone imbalance is something that a lot of women face. They face that with infertility or difficulty getting pregnant, and sometimes just really very much irregular periods, painful periods that happen more frequently or less frequently than they would like, or at least on a regular schedule. And just because they remove your uterus doesn't mean they have fixed the hormone imbalance. So we're going to talk about how to actually do that. I will say that birth control pills are not always an effective way to replace estrogen and progesterone because they are not bioidentical. They are synthetic estrogens and a synthetic progestin. And a lot of times they can wreak havoc in healthcare or in an individual's health later on in life. And we'll talk quite a bit about that as well. What I will say is that I don't believe that hormones are rocket science. Honestly, I think that, yes, the symptoms can become complicated, but when we test, it's pretty easy to sort it out. But the reason why it's important to sort things out earlier rather than later is because women want to hang on to their memory. They want to hang on to their ability to move, and they want to be able to hang on to their eyesight. And those are the things that are significantly diminished with time and with hormone imbalance. So hormone imbalance really is a thing. These are some of the signs and symptoms of menopause and some of the changes that happen. It doesn't happen with everybody, but I will say that the majority of the time, these are significant enough that we notice them. They change our lives, they can change our personalities, but a lot of women will put off going to the doctor because they're so busy with children, with home, with work, that we'll just get around to it. But then all of a sudden time just starts clicking off, and pretty soon you're in your 40s or maybe even beyond, and then you're finally taking some time to focus on it. But even then, it's hard to really sort out why am I really going to the doctor? Because we put it off for so long. We want to make sure that symptoms can be changed for the better. We want to make sure that we can ensure that these symptoms can be controlled so that you can have better quality of life. For those that are not muted, if you could hit your mute button, that would be great, because there's a lot of feedback coming in right now. So that would be awesome. Thank you so very much for muting that. Appreciate it. So symptoms do not have to be debilitating. They can be treated. Are they easy to treat? Absolutely. But sometimes we need to pay really close attention to those other changes that are happening in our life as well, so that we can make the best choices for ourselves. So I want to give a lot of credit to Dr. Pam Smith. These are 3 of the books that she has written, and there's actually an updated version or a second volume to What You Must Know About Women's Hormones, and that's due out in February. And then she's going to have What You Must Know About Men's Hormones, and that is going to be published around Easter time. So she has been very gracious with her time in helping with everybody, including myself, understand hormones and hormone symphony. But she has done this in a manner by which she's also educating medical professionals as well as patients. She did a immune seminar with us back in October, and it was fantastic. So you can find that out on our website and our YouTube channel. But a lot of the information that I'm going through tonight, she has graciously shared with us. And so I just want to give her credit for that. So there's really serious consideration given to hormone replacement therapy. That's what HRT stands for. And the reason why we consider it to begin with is because we want to get rid of our symptoms. We want to prevent memory loss. We want to maintain good cardiovascular health, bone health, and we want to make sure that we can continue to repair and grow those organs, skin, and other cells in the body so that we don't overdo it, and we certainly don't ever want to lead to cancer. Hormones that regulate growth and repair are insulin, growth hormone, testosterone. There are 3 estrogens as well as DHEA. And that is not only growth and repair of skin, but it's hair, nails, and also internal layers of skin, such as our blood vessels and our organs. There's so many different of symptoms that are applied to menopause, most of which are not necessarily specific to just one type of hormone, but they can be related to a wide variety of hormones. And the next probably 15, 20 slides that I'm going to go through fairly quickly, because you all recognize what these symptoms are. And then I'm going to come back and I'm going to apply those hormones specifically to the categories of symptoms, but then we're also going to show where they overlap. So a lot of times it's not just, lack of libido, weird dreams, but it's also very general things such as panic attacks, depression, anxiety. Even when we talk about indigestion, swelling in our ankles, hair loss, sore breasts, those symptoms can apply to a wide variety of hormones. They're not necessarily just estrogen, but we can definitely see a change in varicose veins, even that funny nuances that go along in our skin, rapid aging, memory lapses, migraines, weight gain. Oh my gosh, definitely associated with hormones. But estrogen is not necessarily a bad hormone. She is necessary in over 400 regulations and functions in the body, such as there is a specific enzyme that prevents Alzheimer's disease. So if you don't balance your estrogen early on, and if you do have a genetic predisposition to Alzheimer's, the lack of estrogen can actually make that worse. Estrogens can increase metabolic rate. It improves insulin sensitivity. It changes and regulates body temperature. How many people complain about being really cold, especially cold hands and feet? That's not necessarily always estrogen. It can be thyroid as well, but estrogen plays a huge role. And improving sleep, as well as muscle mass, let alone muscle damage. We can, if our estrogen is balanced throughout our life, we don't see issues with cataracts. So I'm 58 years old. And when I was in my very early 50s, I had my cataracts removed, and come to find out it's just because I had been living with years and years and years of estrogen imbalance that those actually developed. And my ophthalmologist didn't say that. And certainly my GYN never said that. And my GP never said it either. Sorry, my dog is really needy tonight. And so she's kind of whiny. I apologize if you're hearing this silly little whine down here. But estrogen is really important as well to regulate blood flow, as well as to decrease the amount of plaque that forms in arteries, right? Now, we always hear that estrogen is really bad and that we can't do estrogen because it's going to cause cardiovascular risk. And really, it's not. It's about that balance. It can decrease blood pressure. It can change our bad cholesterol into good cholesterol and make sure that we have enough of that. Our fine motor skills, those that have tic or tremor, that can be treated with estrogen as well as other hormones. And it can definitely change the amount of water content in our skin. So if our skin becomes thin and we wrinkle, and you can see that kind of crepey skin developing in the décolleté, but also in the arms, that a lot of times is a change in estrogen balance. So HDL is the high density lipoproteins, which are supposedly our good cholesterol. And if we have good estrogen balance, then that actually increases, which is a good thing, which then can decrease overall heart disease quite a bit. So lipoprotein A is one of those funny little chemicals that, combined with bad cholesterol, makes plaque. Estrogens can improve mood. It can improve our libido as well. And it helps us to maintain bone density, because osteopenia and osteoporosis is a real issue. And it can be a problem that starts earlier in life. You don't necessarily have to wait till you're 70 to be diagnosed. Estrogen improves sexual interest. It can decrease wrinkles, even when we apply it directly to the skin. Again, here's another issue with eyes, with macular degeneration, and it decreases the risk of overall colon cancer. So whenever we're talking about mood, whether we're talking about depression, irritability, anxiety, even sensitivity to pain, estrogen plays a dramatic role. And Dr. Pam Smith actually provided a wide variety of references and there were some physicians that were registered for this seminar. So I wanted to make sure that those references were there. However, when you have too much estrogen, these are some of the issues. You can have increased risk of uterine growth and uterine cancer, water retention, headaches, poor sleep, panic attacks, swollen breasts, and cervical dysplasia is really the changes in the skin around the cervix. When you have too much estrogen, you can have changes in your periods because estrogen is very important when it comes to the thickness of the uterine wall. We can have an increased risk of a wide variety of cancers, not just in the breast, but in the uterine lining, as well as the ovaries. And we see a higher risk of autoimmune disease. High estrogen levels can also impact our thyroid. It can cause us to be sleepy and slow, and it can cause mood swings. Not good. And these are a lot of symptoms that I hear about every day. How do I get rid of these? How can I change this? I don't like how I feel. The lack of exercise can also be caused by estrogen dominance and estrogen excess. But if you don't exercise, you can actually contribute to too much estrogen in your body. Estrogen in the brain is very, very important. Dr. Smith alludes to these are her 5 key things that she's really concerned for patients, because they complain all the time that people think they're losing their mind, that their body is not connected to their brain, and that they've lost the ability to spell simple words. I mean, that literally happened today. I was talking with a gal and she says, I have to think twice about how I'm writing things down. And people are always losing simple things like their keys. They walk into a room and they're like, I don't remember why I'm here. And so that then makes us worried that we're early onset Alzheimer's or early onset dementia. And maybe it's just literally a hormone imbalance. So we want to make sure that we can balance not only estrogen, but some of the other hormones as well, because again, we don't want to lose our memory. We don't want other things to set in as older as we get. We want to make sure that we can be as young as we are for as long as we can be. And this one is one thing that I think is really important, is that it is a natural antioxidant. Estrogen also needs to be present to turn progesterone receptors on. So those are like sisters. They're not twins, but they're sisters. Wherever there's an estrogen receptor, there's a progesterone receptor right next to it. So if you don't have enough of estrogen, you don't turn the progesterone receptor on, and that can actually cause estrogen dominance just in that one little area, one little fact. So this I want to show you is actually a study from 2019. So we're talking about very recent research, where if we do not have enough estrogen, we can actually cause menopausal symptoms and have issues with cardiovascular health. However, beneficial effects of a good balance of estrogen was actually shown in this study to help prevent cardiovascular risk. And again, this was from 2017, but then he went back and re-looked at research that was done with the Women's Health Initiative that was between 1998, and most of that actually stopped in the early 2000s. But he went back and looked at a wide variety of women and reclassified a lot of that information. So when we take a look at estrogen, we actually see that estrogen is usually reduced in heart failure. So they're actually saying that there's a possibility in the future that especially when women have cardiovascular risk, when they have a heart attack, when they have an ischemic attack, such as a myocardial infarction, we may be actually giving estrogen to help with that healing process. Oh, what the heck is going on there? There we go. And of course, as I alluded to earlier, we had this study, which is not new. It's 2014. It's fairly recent, but this was a fairly large study, a wide variety of women, where they looked at estrogen replacement actually improved the issues associated with cataracts, which cataracts can diminish your eyesight. Diabetes can diminish your eyesight. It can also change your cardiovascular risk. And diabetes a lot of times will add weight to your body, but it certainly can decrease your overall internal organ health. Now, most of these studies were not done in the United States. They were done elsewhere, and they were actually done using bioidentical estrogens, not necessarily synthetics, and certainly not equine estrogens. So estrogen deficiency is suggested to be a state of accelerated aging. So what that means is if you don't have enough estrogen, your body ages quicker. In this 2013 study, researchers estimated that over the past decade, and look at this, 18,600 to 91,600 postmenopausal women in an age group between 50 and 59 who had had a hysterectomy may have died prematurely because they did not get adequate estrogen replacement. That to me is awful. And that was published in an American Journal of Public Health in 2013. So this can be startling, and it should be startling, because the bottom line is we want to be healthy. We want to do things in our retired years, and we don't want to have to be toting around a suitcase full of drugs and not feel our full energy that we can participate with family and travel and do the things that we want to do. So when we look at women who are not getting enough estrogen, a lot of times their lives are poorly understood, mainly because they don't speak up, and they may have had a surgical treatment such as hysterectomy, and an oophorectomy is where they remove the ovaries as well. So sometimes when that happens, especially here in the US, the first thing they do is they give you oral estrogen, or they slap an estradiol patch on your rear end. And that is kind of okay, but it doesn't necessarily match what is necessary for you for replacement. And that's where things can become a little bit dicey, because they may underestimate what you need, or they may overestimate what you need. So they're not dialing in specifically to what you need, because the reason why you had to have a hysterectomy and possibly have your ovaries removed as well was a hormone imbalance to begin with. So just removing that vessel doesn't correct the problem. So the method of estrogen delivery is vital in assessing its benefits and uses. And the reason is because if we are using oral estrogens, whether it's Premarin, synthetic like birth controls, or even a natural estrogen like estradiol, oral estrogens tend to have more issues with stroke, with cardiovascular issues, and certainly with gut issues. And we don't see the same thing when we're using estrogen on the skin or in the vaginal vault. So when estrogens are given by mouth, again, either synthetic, equine, or even natural estrogens, they can increase blood pressure. They can increase triglycerides. They can increase gallstone issues, liver enzymes. They can increase sex hormone binding globulin, which decreases testosterone, which decreases your sex drive. It can also interrupt the metabolism to serotonin, which is your happy hormone, and that happens primarily in the gut. Most of your happy hormone is made in your gut. So if your gut isn't happy and healthy, you're not going to be happy. It lowers issues with being able to maintain feeling full, and it can increase. So prothrombic effects means blood clots, and it can increase carbohydrate cravings. I don't have to tell you that when you are feeling imbalanced, that a lot of times carbs are the first thing you dive into, whether it's a bag of chips, mac and cheese, or you're looking for peanut butter on bread. It doesn't matter. The carbs are carbs, and those simple carbs can then throw off your glucose balance as well. So conjugated equine estrogens are also called Premarin, and they are still very commonly prescribed orally as well as vaginally for vaginal dryness. And in my professional opinion, they should never be prescribed, period, end of story. And the reason is because we have learned, especially in the last 20 years, that they have more issues attributing to breast cancer, ovarian cancer, uterine cancer, and we just don't metabolize equine estrogens. Those are estrogens that are supposed to be in a horse. I'm not a horse. You're not a horse. Those are super huge doses, and they just don't work as well. But what we do know is that when we use medications, natural estrogens, progesterone, testosterone through the skin, we get much better control of blood pressure, cardiovascular issues, as well as internal organ workings. So really, treatments should be individualized, and we're going to get into how to do that. And compounding pharmacy is really the best way to go about doing that, because we can hone in on just exactly what you need. So when we talk about progesterone, so women have 3 estrogens in their body, and we have progesterone, and men have these hormones as well. They're just in different ratios. but it is one of the sex steroid hormones. It plays an enormous role in menstruation, maintaining pregnancy, as well as the formation of embryos. It's made in the ovaries on the outside of each of the egg that is developed and ripened. And then in menopause, because we're no longer doing that, it's primarily made in the adrenal glands, which sit on top of the kidneys. Progesterone is primarily made from pregnenolone, and pregnenolone is made from cholesterol. So when someone is put on a cholesterol medication like a statin, your hormones can actually decrease significantly because you don't have the original building block by which all sex steroid hormones are made.
Michelle, there is a question in the chat.
Yes.
Someone asked, how do they know the amount of estrogen to give?
Well, first of all, we test. And when we test, we can then evaluate exactly how much to give. We may have to adjust that dose up or down over the next probably 6 to 12, maybe even 24 months, but at least it gives us a very good starting point. Now, when we're going to actually get into testing, I recommend saliva testing because it is a true representation as to what's happening in the cell. Whereas looking at hormones in the blood is kind of like, well, you've all cooked, right? And so when you make a cake, let's say you're pulling a box cakes mix, when you mix that oil and water, the oil floats to the top, right? And oil and water doesn't mix. Well, our hormones are actually oils. And so they float around in a water medium, which is our blood. So we have carrier molecules to carry it away to the cells. So that's why it's really important to make sure that we're evaluating things appropriately. We also have to be careful of, if you are currently on therapy, exactly when to test. That makes a big difference. We don't just necessarily test on our way home from work, because that isn't necessarily going to give us the best result. And that's the bottom line, is that, we spend a lot of money on insurance. We spend a lot of money on copays and deductibles and things like that. We might as well be doing this properly so that when we do get that information back, it can be interpreted the right way. Proper dosing can be given to you, and then we're not wasting your time, and we're actually gaining time because you're going to hopefully feel better sooner. Sorry, this is one of the most one of the biggest topics that I am just incredibly passionate about. So I get really long-winded. So I apologize. This is like a fire hose of information. And this is recorded, so you'll be able to go back and look at it on our website and also our YouTube channel. But again, balance is key. Progesterone is really important to maintain a good diuretic so you don't have pudgy ankles. It's anti-inflammatory. It balances estrogen. It potentiates the work of GABA, so you have better balanced moods. It enhances the action of thyroid. It actually has a positive effect on sleep. It helps in the aid of building bone. So again, hormone balance early on in age is very important, and it's very important to maintain it throughout our years so that we don't run up against osteopenia, osteoporosis in our 60s, 70s, and beyond. It helps to maintain bladder function, and progesterone is literally progestational, which that's where the word comes from. And that's what helps us to maintain a pregnancy. So most women feel really good while they're pregnant. Maybe there's some morning sickness in that, but when I hear about women who have had postpartum depression, it's because as soon as that uterine lining, the placenta, is delivered, then your hormones go from, way up here to all of a sudden it's baseline or below. And that dramatic change can definitely change our mood. It can change our whole being because we feel so much different. Plus we've gone through the trauma of giving birth. Progesterone helps to prevent anxiety, irritability, and mood swings. It helps to eliminate fat. It helps to increase our metabolic rate so that we do metabolize our carbohydrates, our fats, and our proteins appropriately. It increases scalp hair because a lot of people complain about their hair thinning as they get older. There goes some of mine now. It increases the conversion to kind of those active, nasty estrogens to the ones that should be stored. And it lowers our bad cholesterol. And it helps to promote our immune system. That's what the Th2 immunity is. It helps to promote overall good immunity.
Michelle, there's another question in the chat.
Sure. Yes.
So they asked, what about for those with history of migraine with aura or family history of cancer?
We will definitely get to that. So when you've got migraine with aura, a lot of times those migraines are timed very specifically in your cycle. And we can actually perform saliva tests where you literally test every other day. And we can look at a variety of levels of estrogen, progesterone, testosterone, DHEA, even cortisol, our stressor hormone during those times, so that we can pinpoint exactly where are you on the scale. Because most of the time when you start bleeding, day one is the first day of your menstruation, estrogen and progesterone are pretty low. And then slowly estrogen climbs, and then you ovulate, and that's when progesterone starts to climb. And then estrogen comes down, and then progesterone peaks, and then it declines, and that's when you start your cycle. You start bleeding again. So most of the time people have aura and migraine within a week or so prior to getting their period. And then once they get their period, it usually goes away. Well, that tells me that we're probably low in progesterone, but we need to evaluate all the hormones, because if we don't know, we are guessing, and that doesn't help anything, right? You're having a lack of quality of life. You are literally losing time because you're in pain. And that's no go. If you ask me, that is absolutely no way to live. Time is the one thing we never, ever, ever get back when it's gone. You can make more money, you can buy other things, but you can never make up more time. So if you're stuck in a situation where you're not feeling well, we need to get that back. So we test, and then we know, and then we can move forward, and we can actually time specifically when we perform the saliva test, perhaps when we do a gut biome test, perhaps when we do a complete thyroid panel, perhaps when we look at urine metabolites of all of these hormones. All of those things are absolute key to maintaining really good health. Now, when we address issues when it comes to family history of cancers, just because family cancers are there doesn't mean that you are going to get it. It literally means we don't have to turn that gene on. Now, when there's a significant history of cancer because of mom and auntie and grandma and maybe even sisters, there are very specific tests that can be done to identify what needs to be changed. And we can use nutraceuticals to change those things. We can use very specific prescription medications to change those, to hopefully alleviate the chance of you ever getting cancer or those specific kinds of cancers. And this is the one thing that I think Pam Smith is incredibly good at. So she has breast cancer on both sides of her family. She has lost her aunties and her grandmothers all to breast cancer on her mom's side and her dad's side. So she dove in really early, and she identified, what genetically is going on, where she's at with her vitamins and nutrients. But she's also super careful about how she eats. And then she monitors her levels of vitamins and nutrients, and she monitors her hormone levels on a regular basis. And she's 67 years old, and there's absolutely no indication that that's where she's at, that she's even headed in that direction, because we can evaluate how you metabolize your estrogens, how you metabolize your other hormones as well. And that's really important. Thyroid health cannot be ignored. It's not part of not a significant part of this conversation, but it is a significant part of your overall health. So when progesterone helps support the immune system, again, if you usually people with cancer have a low or a suboptimal immune system. When progesterone is low, we see anxiety, we see depression, irritability, mood swings, insomnia, pain and inflammation, osteoporosis, and excessive menstruation. Those are those heavy periods that come frequently. We see hypersensitivity to chemicals, to smells, to light. It can be a wide variety of issues. And that's, again, where the migraine headaches come in. We also see weight gain when progesterone is low, and that can happen primarily around the butt and the thighs. Libido, there's just not much there, and it decreases our good cholesterol. So we need adequate levels of progesterone. Causes of low progesterone can be impaired production. Perhaps you have some ovulation issues. You may actually have some hormonal signaling issues that are changed. When stress goes up, progesterone comes down. And then there's a variety of medications, such as antidepressants, can actually lower your regular hormones. Sorry, I'm all of a sudden very dry. When we talk about diet is a 4-letter word. It's a dirty word. But if we don't have a good diet, we die. When we excessively take in too much sugar and saturated fats, especially specific animal fats, we can see a decrease in a wide variety of nutrients that are vital to maintaining good hormone health, but really good overall health. Anytime there's deficiencies in B6, in C, in zinc, vitamin A, and also decreased thyroid hormone, we're going to see low progesterone as well. Now, synthetic progestins do not have the same activity as progesterone, and synthetic progestin is medroxyprogesterone acetate. It's also a variety of synthetic progestins that are put in IUDs, as well as the depot shot for birth control, as well as a wide variety of oral birth control pills. And those synthetic progestins are sometimes used to stop menstruation. We can do that with natural hormones as well without the side effects of synthetics, such as weight gain, fluid retention, depression, headache, decrease in energy. We cannot take synthetic progestins and maintain a healthy pregnancy either. And they can absolutely trash your libido. But we see this a lot. We see acne, specifically cystic acne. We see hair loss on the scalp. We can see a wide variety of other issues like insomnia, where it just really interrupts our sleep. And that interrupts our sleep as chemicals in the brain, where people complain that they can't shut it off at night. It can then interfere with our natural production of progesterone. So it's kind of like a catch-22. It kind of keeps us in that loop, and it makes it worse and worse, and we spiral down. And now synthetic progestins can actually cause spasms of coronary arteries, which can lead to cardiovascular disease. It can increase breast cell replication and growth, which can cause fibrocystic breasts, as well as those risks that lead to breast cancer. And this, again, are just some references, and a lot of this information is not new. So again, here's JAMA, here's internal medicine, or the International Journal of Cancer. This is from 2005. We've known about this for a long time, and yet we still have prescriptions being written all the time for this. So when you add estrogen plus a progestin, it increases breast cancer. And we've known that for over 20 years, and yet they're still very, very commonly prescribed. And I don't see them in my pharmacy because we primarily deal with naturals, but we do see that a lot when we're helping women transition from synthetics to natural hormones. Looks like there's another question in the chat.
Would you like me to read it, Michelle?
Sure, please. Yes.
Okay, so it was a kind of um, an add-on to the last question, which was, what about for those with a history of migraine with aura or family history of cancer? The follow-up is, I was wondering about hormone replacement for those with migraine and cancer.
So again, we need to test, and then we need to evaluate the risks versus the benefits. And I will say, when we use natural hormones in physiologic dosing, we see a decrease in migraine occurrence. We can a lot of times make it go away completely, and we see a very much reduced risk of cancer. And this is the thing. If natural hormones, bioidentical hormones, caused a lot of problems to begin with in physiologic doses that are normally made in the body, we'd all be dying of cancer before we even got to childbearing age.
Sorry, so she's asking, so these are not contraindicated in postmenopausal women with the migraine?
No, they are not contraindicated. No. Now, what I will say is that there are often more issues behind migraines other than just a hormone imbalance, because you can have significant migraines associated with other areas of inflammation, as well as thyroid dysfunction, as well as gut issues. So sometimes we focus on estrogens and progesterones and testosterone, and that's really important to balance, but it may not be the only area that we look at, but they are absolutely not contraindicated. What we need to significantly evaluate risk versus benefit is when there is a very strong family history. And that's where we need to do a deeper dive to ensure that we're not going to increase your risk. But again, when we keep natural hormones, bioidentical hormones, in doses that are normal to the body, and we don't exceed those, we can control symptoms without additional risk. And here we go. That was a great lead in. So natural progesterone effects not seen with progestins, it improves sleep, it improves blood pressure, and it eliminates fats, and it balances estrogen, it lowers cholesterol. It increases scalp hair. It's a natural diuretic. It's a natural antidepressant. It's a natural anti-inflammatory. It improves immunity. And again, some more reference. More reference. So I'm going through these slides fairly quickly because I want to get to some other things that are very important, specifically what kinds of therapies can we use. This study was, it looked at 80,000 postmenopausal women over 8 years using a variety of hormone replacement therapy. And they found that women use estrogen in combination with synthetic progestins had a 69% increased risk of developing breast cancer when compared to women who never took hormones to begin with. However, women who used natural progesterone in combination with natural estrogen had no increased risk of developing breast cancer compared to those women that did not use hormones. So again, you have a group of women who didn't use hormones at all. And then you have another group of women who used natural estrogen combined with a synthetic progestin, and they had a 69% increased risk of developing breast cancer. And then you had another group that used natural estrogens with natural progesterone, and they had no increased risk whatsoever. That's pretty significant right there. And again, these women were followed with testing. We need to test. It's really important. We test for a lot of other things. We test for blood pressure. We test glucose levels. We test to look at how much sodium and potassium is running around our body. We test our thyroid function, but we need to do a deeper dive, and we need to really focus on exactly what are those essential parameters, because all of those parameters are going to maintain good balance, not just today, but in the future. And that's what we're trying to get to, right? Is a very healthy future. So when we have a prolonged use of progesterone without adequate estrogen, and a lot of times I see this because you can get natural progesterone in a cream over the counter. And so some people just start to self-medicate. You can see increased weight gain. You can increase total cholesterol. But we can also see increased depression. And then we can see increased insulin resistance. So you see weight gain, not just in the bum and the thighs, but also around the middle. And that's where the increased storage of fat. And you can see a significant decrease in libido. So again, progesterone is not the angel and estrogen's not the devil. It's not, there isn't a good guy and a bad guy. Everything needs to be in balance. Everything needs to be in balance. If you have one wobbly tire on your car, you're going to know it because your ride is not going to be what you want it to be. But if you have equally inflated tires, you've got a nice smooth ride, right? No different than hormones. Again, when you have too much progesterone and not enough estrogen, you can have an increased rise in cortisol, which is your stressor hormone. And a lot of times that builds anxiety and it builds depression. It also increases your appetite, specifically your carbohydrate craving. So it can be this vicious circle. And again, so if we test, we know exactly what's going on. Now, to touch on testosterone, it is, again, one of our sex steroid hormones. Women have a lot less than men. We make about 0.3 milligrams per day at our peak. Men make about 10 milligrams. So, that's a lot. That's 30-fold. Testosterone is known to increase sexual interest. It also really helps to maintain good skin turgor, and so that it becomes, I don't want to say stiff, but it helps to maintain good firmness of skin. It also is very important in maintaining good bone health. It also aids in pain control. So again, balance is key. When we lose testosterone, and testosterone is literally the second hormone that declines with time. So in our 20s and 30s, progesterone starts to decrease. Testosterone starts to decrease around in our 40s and 50s. And estrogen is actually one of the last hormones that drops off. What I find also very concerning is that there's a very high rate of divorce in women in their 40s and 50s. And that has a lot to do with hormone changes, because we're just not the same person that we were in their 20s. Our spouse isn't necessarily the same individual either, but we are expected to maintain that, but yet we are not balanced. And so with balance, we actually see better harmony throughout the body.
Michelle,
and
that's
if you'll
a great,
notice,
sorry, I don't mean to interrupt. That's a great lead into a question that just came in that asks, do balances of hormones change over time? How often should testing be done to determine the needs for balance?
That is a very, very, very good question. I'm a firm believer that we should get a baseline sometime in our early 20s, and we should test at least every year. And that's not hard to do whatsoever. We'll show you specific examples of different types of testing in just a few minutes, but we look at everything else every year. Why not look at hormones, especially when they're so critical to maintaining vital organ function, but overall body function as well. Our bodies were made to adjust for balance. And the hormone levels that we have in our 20s and 30s are much higher than they are in our 40s and 50s. And again, in our 60s, 70s and beyond, they're a little bit lower. That doesn't mean that once you turn 50, 55, that you shouldn't be taking hormones. And that doesn't mean that if you're in your 70s or 80s, that you don't need to be taking hormones either. It just means we need to adjust to what is necessarily in your body. Because I know of women who are in their 70s that have their uterus and their ovaries that are still making decent amounts of estrogen, but they're not making enough testosterone and progesterone. So those are the only things that we replace. conversely, I know of people, I know of a 27-year-old that is trying to get pregnant and maintain good pregnancy, but her estrogen and progesterone levels are practically zilch. And this is a woman who's never been on birth control pills, who did use an IUD, but it was not a hormone IUD. She had that removed. She's been married for several years now. And she's never been able to get pregnant, and everything else looks great. But again, nobody was testing her hormones. And she came to see me one day with her mom, who was picking up some stuff. And she just asked a couple of questions because she saw something about testing that we do. So I just gave her the quick elevator speech, and she started crying. And at 27, you should have balanced hormones, right? But for whatever reason, she does not. And she's not, she's a very thin woman. She exercises quite a bit. And that may be the source of her hormone imbalance, is maybe she exercises too much. That's a possibility. So we do have to pay very close attention to balance, just like everything else, especially like your wheels on your car, right? So we need to maintain testosterone balance as well. Look at self-esteem, saggy cheeks, not just these, but the ones we sit on, droopy eyelids. I know of a lot of women who have like a second eyelid that it droops all the way down, where this actually is pulled way down on top of their eyelashes almost. That is a sign of testosterone deficiency. Very thin lips, where the upper lip actually just forms this very thin line. Again, lack of testosterone. But what's also interesting is dry eyes can be a symptom of a lack of testosterone. Not always, but it can be.
Michelle,
Mm-hmm.
There's a question in the chat that asks, does this also affect women who cannot hold a baby to term? And it came through when you were telling that story about the 27-year-old, if that helped.
That is very true. And it's not just testosterone, it's usually progesterone as well. But what I find very interesting is that when women are going through issues of infertility, there's so many areas of hormone balance that are not addressed. And a lot of times they're only looking at very simple levels in blood. And my professional opinion, in the 20 years that I've been studying hormone, I think we get better results in looking at hormones in saliva. And so I have actually helped many women get pregnant and maintain pregnancy. And my first gal was back in 2004. And again, her mom was a nurse. She's a veterinarian, and she was 29, and she had a 10-year history of infertility. She was married at 18 and immediately started having babies. And so she was having difficulty maintaining a pregnancy. She could get pregnant, but would lose everything between 8 and 14 weeks. So she just couldn't maintain it. They went ahead and adopted 2 beautiful, beautiful children. And then she came to see me, and we did a saliva test, and we worked with her naturopath. She had a regular GYN. And through that, we changed her hormone levels. So we actually gave her natural estrogen and progesterone. Her testosterone was fine. She actually had some fairly thin scalp hair, and she was shaped very much like a pear. So she had a pretty big bum, not a lot of breast tissue, but she had a pretty big bum. And so this makes me really emotional sometimes. So this was in April and May, and we corrected her hormones over the summertime. And at Thanksgiving, she told everybody that she was pregnant, and she had a beautiful baby the following summer. And that was just absolutely super cool. When she found out she was pregnant, her doctor gave her a prescription for vaginal progesterone suppositories so that she could help maintain that pregnancy. And that baby was 8+ pounds, beautiful, strapping, gorgeous baby. Baby's now a teenager. Teenager, because that baby was born in 2004. And then about a year and a half later, she called me and she says, I need a refill on my progesterone suppositories. And so she actually has a beautiful family of 4. And, she was medically educated. right? She was a veterinarian. Her mom was a nurse. And again, it was through casual conversation that we were able to help her with that. And it's just I call her my miracle mom because it was my first woman that I helped through that. And it was pretty cool. Absolutely cool. But again, when you've got issues with low hormone or hormone imbalance, we have to get down to the root issue and what is causing that. Now, teen pregnancy isn't something that we want. A lot of us were sexually active in our teens. So what did we do? We jumped on birth control pills. I'm not saying that is you should never do that. But again, that comes with consequences, but we should always evaluate what's going on so that we can correct issues should they arise later. So let's talk about vaginal dryness, because this is one area that I think is significantly overlooked, and yet I think it is absolutely detrimental to sexual health and sexual being. And I think it is a huge wedge that happens in a good marriage, and it doesn't need to. And a lot of times what I hear, and I actually heard this from a GYN, she's like, well, it's just vaginal dryness. It's not that big a deal. It's like, well, if you don't use your vagina, if you don't have sex, it tends to close up and become drier and drier. So it just gets worse and worse. And you don't want the bladder to fall into the vaginal vault, and you don't want the rectum to fall in, where it collapses in the vaginal space, and then you have to have surgical repair. And what about urinary tract infections? I mean, that can change your mood. It can change your whole lifestyle. So it doesn't need to be that way. There are ways to help build up your vaginal tissues without increasing your risks to cancer and hormone imbalance. A lot of times there are some commercially available products out there. I don't like Premarin. There is estradiol vaginal cream, but they can be really messy. I personally prefer estriol. It is the third metabolite of the estrogen cascade. It's much weaker, but it has a higher affinity for the vaginal tissues, meaning it likes to adhere to it, and it builds it up without overbuilding it. We can also use DHEA. Now, when somebody has had breast cancer, we do have to evaluate those risks, and there are some non-hormonal products that we can use. Sodium hyaluronate, vitamin E, and oxytocin vaginal gel can safely be used in women who have had cancer. So, some of these are a little more expensive than others, but I will tell you that a compounded estriol vaginal cream is going to run you from $55 to $60 for 30 grams. Last time I checked, estradiol, which was commercially available, runs about 150. So compounded medications aren't necessarily going to break your piggy bank. And we need to be very careful about personal lubricants. A silicone-based product is better, and there are some really good products that are thinner. They're more like oils, like Uberlube is one that I think is fantastic. It's got beautiful, sexy packaging as well. And then also other silicone products like Slippery Stuff, but they also help to decrease the incidence of urinary tract infections. So when we're dealing specifically with mood swings, because this is the second most common issue that we try to help with, is that the first thing that when somebody is depressed or anxious, they go to the doctor. When they finally go to the doctor, a lot of times they're given a prescription for antidepressants. And then they are on them for years and years and years, but they see minimal changes. Rarely do I see a woman who's like, yeah, I started taking my sertraline or my citalopram, and I'm like, this is great. This is fabulous. That is maybe 1 out of 100 people when I talk to them where those medications are actually working. And a lot of times antidepressants will decrease your libido. So it's kind of like, where are we going with this? You might feel a lighter mood, but you just don't care to be intimate, and that can be a detriment to your relationships. There are some very good, affordable over-the-counter supplements. L-theanine is a natural amino acid that decreases anxiety and helps to boost your mood at the same time. And there are other products as well. Hot flashes and night sweats. Oh my gosh, will they go away in time? Well, I hope so, but in the meantime, you feel awful. I mean, if you've ever had a night sweat where you have to rip the covers off and you're drenched, you feel horrible. You don't feel good in your own skin. You don't feel sexy. You don't feel good about yourself. Your mental well-being is very, very low, and you just don't want to be there. It's terrible. And hot flashes during the day can be triggered by stress. They can be triggered by food. They can be triggered by medications. So we need to be really careful about what we're actually putting our body to kind of decrease that as well. So that nasty word diet is very important, because simple carbohydrates can trigger hot flashes and night sweats because it increases our blood sugar level. Alcohol can do the same thing, but if we're not taking in enough water, so you should be drinking half your body weight in ounces. So if you weigh 150 pounds, you should be taking in 75 ounces. So half your body weight in ounces, 75 ounces of water per day. That's 3/4 of a gallon. And maybe you need a little bit of protein. So that's helpful as well. So it's about when you're eating and the timing of what you're eating that makes all the difference in the world. And some people will trial using intermittent fasting. So where you eat between noon and 7 p.m. And that's the only time that you eat. And a lot of times that will flip things around and change things. And some people actually lose weight. It's not for everybody, but it can do that. When you go to the doctor and you just say, I love my husband dearly. He is, my best friend, and I can't imagine living life without him, but I don't have any desire to be intimate. What do you get? Sometimes you get a prescription for testosterone cream, but that may not be the cause. So again, testing, let's see what's going on. Over the last 20 months, I have heard more people complaining about libido, even though you're in the same room with somebody 24/7. And it's because of a hormone called oxytocin. So oxytocin is a natural hormone that's produced in our brain that if you've ever given birth and that baby is pulled out of your vaginal vault, out of your uterus and plopped on your chest, you make a lot of oxytocin to start bonding with that child. And it makes you feel warm and cuddly and cozy. Well, we can actually put that in a nasal spray so that if you are depressed, if you are anxious, if you have no sex drive whatsoever, or very little, we can actually help you with a nasal spray of all things that you can use once or twice a day, or even just right before intimacy. And it will give you a better sense of connection. It will actually help you feel that you want to be with that person. And there are some herbal supplements that we can use along with this as well. So here's Tasia, one of our technicians, with a nasal spray bottle. Tummy bulges. Oh, that weight around the middle. So, there's a wide variety of weight loss medications. There's a lot of weight loss routines out there, and a lot of them work. And then if it doesn't become a lifestyle change, then you go right back to where you were. So if you are 175 pounds and you want to lose 20 pounds, you jump on a weight loss program. If you don't change what actually needs to be changed, that weight will come back. And so the weight loss program didn't fail. We failed because we went back to our old habits. So how can you actually get a hold of tummy bulges other than pinching them? How can you get a hold of all of that and then make it go away for good? And a lot of times it has to do with hormone balance, as well as stressor hormone, as well as thyroid hormone. But we can use a medication called low dose naltrexone to help enhance that while we're decreasing inflammation and pain and boosting your immune system at the same time. So you've probably heard about the product Contrave, and naltrexone is actually one of the ingredients in Contrave. It's commercially available. Your doctor can write a prescription for it. You still need to maintain minimizing your simple carbohydrates and maximizing your complex carbohydrates, vegetables, and a little bit of protein. Contrave is really expensive and not usually covered by insurance. So how does thyroid play into all of this? Well, thyroid is your master metabolic gland of the entire body. It sits right here in your throat. This is a picture from the 1920s of this beautiful woman who is, do you see how pudgy she is under her eyes and how full she is in her cheeks, and her outer brow is missing, and she's got her hands here because she actually has thickness in her neck. And you can actually see it kind of in her collarbones, right? She's kind of thick here. Well, she had her hormones tested, specifically her thyroid tested back in the 1920s, because we had this testing then. It's just that the testing parameters haven't changed much since then, even though our tests are much more specific. And she was put on a little bit of thyroid, and all of that went away. And she looks, and I don't know if I've actually posted the after, but no, I guess not. So let me go back. We can use medications such as levothyroxine, liothyronine, desiccated porcine thyroid, but we can also use a wide variety of supplements. Now, levothyroxine and liothyronine are considered synthetic, but they are bioidentical. Commercially available product that is out there is also manufactured with lactose and corn products. And a lot of times that actually decreases your absorption of thyroid. So maybe you're getting 100 microgram levothyroxine dose, but you may only absorb half of it. And most people who have low functioning thyroid have a digestive disorder to begin with. They just don't digest very well. And most people complain of having constipation, and we can fix that. But we have to test, and we need to test the entire gamut of categories, not just TSH, not just TSH and free T4. T4 is inactive thyroid. That's levothyroxine. We've got to look at active thyroid, because are you actually converting inactive to active? If you don't convert inactive to active, that's a calcium dependent enzymatic process. That means that slowly over decades, you're pulling a little bit of calcium out of the bone, and that causes osteopenia and osteoporosis. If you have autoimmune disease, we need to look at antibodies. That's the TPO and the TGB. Reverse T3 or RT3 is active thyroid that is flipped around because you're too stressed out. So if we don't know where all of these markers are, we can't effectively and fully evaluate what the needs of that patient is, so that we can replace just what's necessary, not any more, and certainly not less, because after all, you need to maintain good health. And what has stress got to do with it? Stress has everything to do with it. It changes every bit of our body, whether it's mental, physical, or otherwise. And a lot of times people have low back pain because they're so stressed out, because that's where the adrenal glands sit. 2020 was definitely one for the books. And I think we're going to see ongoing long-term issues associated with mental health, because we have not been able to go to church together. We haven't been able to hold each other. We haven't been able to participate in social functions like we're used to. And we have seen what happens when you separate monkeys from each other. They go crazy. And I think most people can attest to not being around other people does make you go a little stir crazy. It can also, if your stress is up, it can decrease your bone density. It can increase your cravings, which again will change your mood and will also change your ability to sleep decently. And it will allow your vitamins to waste out of your body. So let's talk about testing. This is going to get, so we're a little bit past, we're probably going to go another 20 minutes or so. There's lots of different kinds of testing. And I want to make sure that everyone is cognizant of their budget. And I work within someone's budget. We will always try to find what is going to effectively work for you that you can afford. Not everything is covered by your insurance, but in my personal case, I have Kaiser. I don't actually use Kaiser for my labs because I have a pretty high deductible plan and my labs are super expensive. So I can get away with doing testing through saliva, urine, and blood spot. And it's like minimal compared to what LabCorp was going to charge me. So to get a baseline as to where you are genetically, which can evaluate your risks, not only for cancer, but also what is going on with bone health, brain health, organ health. How well do you assimilate salt? How well do you metabolize caffeine? What kind of exercise should you be doing? Are you a candidate for high impact aerobic? Maybe you should be doing more like yoga. And again, it's your genetic predisposition to how you should look at these elements so that you can, again, make choices for yourself to be as healthy as possible. The 3x4 genetics testing is literally a cheek swab. It's similar to the 23andMe, but it is much more expansive. It looks at 36 core elements, and I believe they've just expanded that. Tony Marthaler is a nurse practitioner over in Green Bank, and she does telehealth. And I believe she said that this just got expanded. I think it's now a 42 core element. And it runs around $500 or so. And that includes Tony's evaluation of that. Thyroid testing, we only look at thyroid in blood or blood spot. It is too large of a molecule to look elsewhere. Vitamin D, very, very important. Again, you can only look at it in blood or blood spot. When they draw your blood, they're going to tell you that normal is between 30 and 100, but optimal is over 70. And what I mean by that is because vitamin D really is a hormone and it helps to modulate your immune system and keep everything as best as it can. Now is a perfect time to test. We really don't have a flu and cold season. It's more like a vitamin D deficiency season. And with everything else that's floating around these days, building and boosting, not boosting, sorry, but building our immunity to be the best it possibly can be is critical. So maintaining good vitamin D level status is the best. We also know that we see very few cancers when people have a vitamin D blood level over 70. That is proven. We look at hormones in saliva because that tells us most closely what's happening in the cells. We can look at hormone levels in the urine, and that tells us what we're doing with our hormones. And are we metabolizing those through good pathways or not so good pathways or really bad pathways? And then we can use herbal medications to change that. When we look at hormones in the blood, it's really difficult to extrapolate because, again, hormones are oils and blood is water, and they just don't stick around. They're carefully whisked off to the cells to do their activity. When we look at cortisol, our stressor hormone, it is really important to take a look at that. But again, we mostly look at that in saliva because the lab isn't necessarily always open when we really want to evaluate what's going on, especially if you're dealing with night sweats, hot flashes, inability to sleep, mood swings, depression, weight gain, things like that. It's important to really evaluate what's going on with cortisol at bedtime. And the lab's not open at 10 or 11 o'clock at night. So we usually use a 4-point saliva to determine what's going on there. So for example, if your cortisol is high at night in the evening, it can lead to overeating, it can lead to weight gain, night sweats, interrupted sleep, crazy dreams, and it can also then cause rebound issues the next morning where you're exhausted, you're completely fatigued. And these are just a couple of some of the saliva kits and saliva urine kits and saliva blood kits that we have available. A basic hormone panel is $200. A basic hormone panel that with the expanded cortisol is 260. Basic hormone panel with the 4-point cortisol and a complete thyroid test is 380, just to give you an idea. So what can you do right now? We can do things to improve your digestion, which will bring better health, which can increase your mood. And that's by getting at least 10 minutes of sunshine every morning. That's hard to do this time of year, right? I mean, we're not going to see decent sun again for probably another 4 to 6 months. But you can increase your vitamin D, which is kind of like sunshine in a capsule. You can also change sound waves that you listen to at night, and that can decrease anxiety. And a lot of times that is like white noise. Yin yoga is a way to move your body and to help stretch and move your blood around quite effectively. And what I really like about yin yoga is it also helps to rebalance those chemicals in the brain that then help with hormone manufacturing. Go outside and put your feet on the ground, bare feet in the grass. Be careful, it's wet and cold or slippery these days, but whenever you can ground yourself, that can improve hormone and mood health as well. We also can do a complete gut test, and this looks at the complete DNA sequencing of what's in your gut, what should be in your gut, what should not be in your gut, but is, as well as what do you do with metabolizing your proteins, your carbohydrates, your fats. All of this is really important because your gut really is your second brain. And you know that when you eat certain things that maybe you're sensitive to, maybe not that day, maybe not even the day after, but 2 or 3 days later, or even a week later, you're still not feeling your best. So, for example, I know of people that have a lot of food allergies, a lot of food intolerances, and maybe they accidentally get into something and they are cranky and irritable for days, if not a week after getting into that. And that's because of what's happening in the gut. The gut becomes very inflamed. You don't make your happy hormone, which is serotonin, and it can change everything from your digestion to your immune system. Most of your immune system's made in your gut, but it can also change what's happening on your skin. Do you get a rash, eczema, psoriasis, acne, all of that, even just thinning of your skin, brown spots, all of that can be controlled by what's actually happening in your gut. And of course, that reflects back to your brain and how you feel, but we don't want our brains to deteriorate. We don't want to lose our memory. And that's super important. And the bottom line is we want to look as young as possible for as long as possible. You don't have to have irritable bowel. You don't have to have small intestinal bowel overgrowth. You don't have to have an autoimmune disease like Crohn's disease to do this test. This test runs about $400, takes about 3 to 4 weeks to come back, and it gives you very succinct information as to what to do, how to change things. Scarlett, is there one more question?
Yes. How does pH affect the gut?
Well, it's very difficult to change your pH if you don't pay attention to what you're eating. But it makes a big difference because and it's not really about the pH of the gut as much as pH in your body, because if your body's acidic, meaning you eat too many carbohydrates, you eat a lot of sugars, you drink a lot of alcohol, well, even moderate amounts, quite honestly. If you're obese, if you're overweight, if you have a lot of inflammation, if your hormones are not balanced, your body's acidic, you will open the door wide open for cancers, more inflammation, aches, pains. You can speed up aging by decades. So pH makes a huge difference. Drinking pH balanced water doesn't necessarily change things for the long term. It really has a lot to do with what you eat and balancing your hormones that will give you better long-term effects. It looks like another question popped up.
Yes, I was just typing an answer.
Sorry.
So that's okay. So she then asked, how does low stomach acid affect this? So I was just going to type in the chat that low stomach acid would mean that your pH is higher.
Correct.
Just to put that into context.
Right. And so, but that's completely opposite of what is necessary in the body. So if you don't make enough hydrochloric acid, enough acid in your gut, you don't break down your nutrients. You don't break down your proteins, your carbohydrates, your fats efficiently. You want a low pH. You want a pH of 1 in your stomach. You want acid in your stomach. You can't eliminate acid in your stomach and expect to be healthy. If you are on omeprazole or lansoprazole, pantoprazole, if you're on those drugs that stop the production of acid, sure, you don't have indigestion, but try getting off of them. It's really, really difficult. All of a sudden that acid just roars back and then you feel terrible. But what you're also doing is you're setting yourself up for osteopenia, osteoporosis. You're also setting yourself up for degradation of the mandible, which is their jawbone. Your teeth can erode and fall out, and your dentist is going to have a hard time helping you with that. It also means that you just don't have a very healthy body. Now, if we go back and we address, for example, BiomeFX gut testing, and we look at why you have indigestion, why you burp, why you have gas, why you have really smelly stools, maybe why you don't poop every couple of days. You should be going every single day, by the way. Or maybe you go way too often. Maybe you've got a skin rash. Maybe you've had eczema or psoriasis most of your life. That can be changed. That's not normal. And that can be changed. And it can be changed fairly quickly. So if we test, then we know. Maybe you've got some bad bacteria. Maybe you're on antibiotics and some icky stuff grew. If you have chronic sinusitis, if you have allergies or a drippy nose all the time, that means there's something growing in your sinuses, in your nose, in your mouth. Maybe you've got not so great teeth, maybe bad breath, because all of this is connected into your gut and it needs to be treated because it can be detrimental to your health. It can cause you to age quicker and you may not be as healthy as you really want to be. It is a very simple stool test. And once we get that back, we can move right into some very easy treatments. And we usually start with the total gut restoration. And we start with Megaspore, which is a type of probiotic that actually survives digestion. And it is a spore probiotic that gives us long-lasting good probiotic effects so that we can see better use of our nutrients, better breakdown of our foods. And we do that for months 1, 2, and 3. But in month 2, we add the Mega Pre, which is the prebiotic. And we do that for months 2 and 3. And then month 3, we add the mucosa, which helps to repair the lining of the digestive tract. So through all of this, we see much better, not only digestion, we see weight loss, we see improved mood, we see much more energy. We see less gas, whether it's belching or flatulence. It's really amazing how in literally 90 days, we've had women and men say that they've lost weight and they feel better. They didn't realize how slow and low they felt. And this kit runs $330 for the 3-month supply. And it's literally 3 months. Everything comes together. I will say you need to drink a good 16 ounces of water with the Mega Pre and the mucosa. Otherwise it can be, it will run right through you, but it's great stuff. This is another product that I really like that not only helps with dry eyes and dry skin, and that includes skin in the vaginal vault, but it also helps to improve achy joints. And this can happen within weeks. So when people have issues with dry eyes, or, dry skin, or dry vaginal vaults, we are using Hyalife 2. And so you only need to take 2 to 3 capsules a day. And so 120 capsules is $100. It's $99.99. But it does work. And I will say it's made by a compounding pharmacist in the United States, and it's used by thousands of people across the United States. We have really good testimony of how well it works. We know that hyaluronic acid is a natural moisturizer, and it works at the cellular level. So you don't necessarily have to always rely on prescription medications to work for dry eyes, dry skin, and joint aches and pains. You can actually use a over-the-counter product. But if you do want prescription products, we can make those for you, because compounded medications are going to be specific to what you need. Commercial products do work about 30 to 50% of the time, but one size doesn't necessarily fit all. And so some people do well with oral medications in some realms. Some do better with medications that dissolve under the tongue, or in creams, or in medications that can be applied in different areas in different creams. So estrogens, usually we're using estradiol and estriol. We almost always use these in a cream, but we can use them in a troche or a drop. We don't like to use them in a capsule because of how it changes digestion. Progesterone is used in an oral capsule. It aids in sleep. We can actually use it for its metabolites when we use it in an oral capsule, but it can be used in a cream or a troche or a drop as well. We can also use it in a suppository, as well as some of the estrogens in a vaginal suppository to help re-nourish the vaginal skin. Testosterone, we don't use orally because of how it affects the liver. So we're going to use that in a topical cream or troche. And oxytocin is always best in a nasal spray. We can put it in a sublingual drop as well, but we don't put it in a troche. Vaginal treatments, creams are messy, right? You put the cream in and go to the bathroom a couple hours later and it falls out. Well, we have better creams now that actually can help keep it in there and keep it in there longer. Or we can use a small suppository, or this is a pearl, which is a half of the little divot, and that works quite well. It's just a little tiny guy, but it really helps to re-nourish not only the external skin, but the internal skin as well. And if there are some irritations, we have a wide variety of bases that we can use, whether it's Alage or Mucilax, to help work specifically to cure your needs. Herbal medications are asked about quite a bit, whether it's evening primrose oil, black cohosh, chasteberry, which is Vitex, DHEA, diindolylmethane or I3C, or it's indole 3-carbinol. It's used to help metabolize estrogens. Please always ask a knowledgeable pharmacist or nutritionist or a knowledgeable physician about how to use these products. Just because they're available over the counter doesn't mean that they're necessarily right for everybody and for all situations. We don't want you to spend any more money than you absolutely need to. We do use low-dose naltrexone to help modulate the immune system, to actually block pro-inflammatory chemicals, so it reduces inflammation in the body, helps to normalize thyroid function and support hormone function. And we have studied this medication incredibly well since 1985 with over 900 scientific studies and case studies. And this medication is also what we use for autoimmune disease. And I am the LDN pharmacist. I'm a certified LDN master, and I speak internationally and support a wide variety of patients internationally with low-dose naltrexone. We are here to help you. We are here to help you in any way, shape, or form. You do not have to change doctors to make a difference in your life. We will work directly with you and your current physician. Very important to test. It's also important to pay attention to medications that you're putting in your body, but also the foods that you're putting in your body. Because if you have a variety of issues, everything that you've been doing up until this point is contributory to your issues. We need to sort those out. So sometimes it means temporarily, or in some cases, permanently changing your diet, changing other parameters so that you can be healthier. But again, these are choices you get to make. I'm happy to help outline everything for you, but you get to choose what you want to do. If you want to be healthier, I'm happy to lead you on that journey and walk with you on that journey, but I can't do these things for you. You get to do those for yourself. Yes, compounded medications are at risk. And this is how you can make a difference and maintain your access to compounded medications. We have flyers that can help you with this. And this is how you can get a hold of us. You know how to register for our webinars. We have one more in this year, and then the 22 lineup will be posted very soon. We do have personal consultations. We can also help personalize medications and supplements for you. We also make pet medications. And come shop our Hallmark shop for the holidays. We're all decked out and it's absolutely gorgeous. And Scarlett, looks like we've had a couple more questions pop in the chat.
No more questions. Everyone's just saying thank you so much for all the information shared. I did want to let everyone know that this webinar recording will be available. Yes, we will be open on Friday after Thanksgiving.
Yes.
But this webinar recording will be on our YouTube channel, and you should get an email either tomorrow or on Monday with the recording, but it'll also be posted to our social media accounts. So if you're following there, you'll get a notification there as well.
Absolutely. And of course, if there's anything that we can do to help you, please reach out. We are happy to do that. Not just myself, but we do have other very skilled, knowledgeable pharmacists on staff, and we're happy to do that. I hope everybody's enjoyed this. I thank you very much for your last hour and a half of your life. I hope this has made a difference. This is a lot of information. It's like, getting sprayed in the face with a fire hose. I realize that, but there's so much, and it doesn't have to be complicated. We can sort things out for you. I hope you all have a lovely Thanksgiving and enjoy your time. And we hope to see you soon. Take care.
Thank you, Michelle. Thank you.
You're very welcome. Thanks for being here.